Welcome back to my channel. This is Nurse Sue Mwangi with Fight for Kidneys. Thanks again for joining me today as we discuss our journey as a dialysis patient. In my last video, we discussed about your dialysis options. That you have been told that you need dialysis. And now you have the opportunity to decide which dialysis options or which dialysis modality is best for your life. In my last video, we saw that, or we found out, there are two ways that you can do dialysis. You can do dialysis at home, or you can also do dialysis at a center or in center or at a clinic. And this clinic could be a standalone clinic or be a clinic that is connected to a hospital. So when you hear me talk about in-center or clinic setting, that means it's either standalone clinic or a clinic that mostly is connected to the hospital or it's inside the hospital. Now, I would think that you have already decided that option, and now basically this is your first time that you're going to start your dialysis treatment, and you're wondering, who are the people that will take care of me? If you are to do dialysis at home, who are the people that will teach me about dialysis? Who are those professionals that will take care of me? Who are those people that will help me go through this journey? It's not an easy journey. It's new, something new in your life that probably you didn't even know about it. But now you have found out that you need to be in dialysis or you have to start dialysis, and you are worried, concerned. How will you do it? I'll introduce the people that will be there for you. They are called the care team. They are the professionals that are trained in their different roles on how to take care of you while going to dialysis or while you are in dialysis. And most of these people will be there with you, whether you choose home dialysis or in-center dialysis. Let's meet the first person. That first person is your nephrologist or your kidney doctor. If you had before, probably some of you have been followed by a kidney doctor, and some is their first time that they are hearing about kidney doctors. So what do really kidney doctors do? What role do they play in your treatment, in your care while you are in dialysis, or someone that you love or you take care of is in dialysis? So your doctor is the main person. This is the person who prescribes all the orders for you. That's the person who decides what treatment is best for you. When I mean what treatment is best for you, I don't mean whether the home day, of course they play that role. They can assess you and say, hey, will you do well with the home modality or in-center modality? Will you be able to do well with peritoneal dialysis, or will you be able to do well with a hemodialysis at home? Or will you be that person that cannot be able to do it at home, but you can do it at the clinic? With the nephrologist, you work together. And also in my last video, I had talked about things that you need to ask yourself when you're told that you need dialysis. And those are the questions that you approach with your nephrologist. And discuss that with your nephrologist or your kidney doctor so that you can decide, okay, which treatment fits for me. So this kidney doctor will be deciding or prescribing orders that are specifically for you. And that will be considering your labs, your overall health. Then this doctor will also be prescribing you some medications. While you are in dialysis, there are some medications that are specifically for dialysis patients. That doctor is the one who will prescribe those medications, will be monitoring your progress while you are in dialysis. That's the person who you'll be seeing on a regular basis, probably monthly, twice a week. And that's the person who will be telling you, how are you doing? That's the person who decide, do we need to make changes? But that's not the only person who decide. You also have to talk to your doctor and let your doctor know, how are you feeling in dialysis? How is it going? Do we really need to make some changes? Because especially if you're new to dialysis, it's that one you are deciding, how is your body working? You have to make sure you are talking with your doctor. How are you feeling your first few months? How do you feel? Do we really need to, does your doctor need to reevaluate the treatment that he prescribed or she prescribed, so that he or she and you can make those changes? The next person you meet, it's a dialysis nurse. It does not matter whether you're doing dialysis at home or dialysis in center. This nurse, if you're doing at home, this nurse will train you on either peritoneal dialysis or hemodialysis. Even this nurse will be communicating with you. You are the person that you will be calling if you have trouble at home, if you have issues. These are machines that we work with. Things can go wrong, things can happen. So that's the person that you'll be communicating with and asking questions. They'll be there to help you walk through. But if you choose dialysis at in-center, this nurse will be there with you. That's the person who will be doing your assessment, checking your weight, making sure when you're walking, your vital signs are okay. That's the person who you be seeing on a daily basis every time you visit your dialysis clinic. And that's the people you need to form a relationship with, because they'll be able to also talk to the doctors on the changes that they see. They look at the trend. How have you been doing with your blood pressures? How are you doing with your weight? Do we need to adjust some weights? That's the nurse. We also have a very special team, and I love them. They are called social worker. While you have been diagnosed with ESRD, or just say you are just an acute dialysis patient, and now you come to dialysis center, or you have to do dialysis at home, that person will be able to help you walk through the emotions. And that's the most important part about social worker, and I love them. Those are the people I feel I go to them a lot, because that social worker help you navigate a lot of things, especially the emotions. When you have been diagnosed with dialysis for the first time, you feel stressed. You feel you have like some guilt, you have some denial, and you're worried. And this is the person that will help you navigate through those things. Will connect you with support group. And support groups are very, very important. Those are the people, probably, if you're new to dialysis, they are the people that will tell you, that will help you understand things to expect. They probably have been in dialysis for a while. They are the people who hold your hand. So it's very important to have a support group. So if you're new to dialysis and you happen to meet your social worker, please ask them, do you know a support group that can help me, that I can connect with, so that I can be able to thrive in dialysis? You need those people. You need that support group. And I do appreciate those patients who are part of the support group, those who lead those support group. Check your area also to see whether there are those support group. But also the social worker will help you with things like insurance. They are the people who connect you, find out what are those insurance, what are the resources out there in the community. Especially in US, there are so many resources that are out there for people who are in dialysis, people going through dialysis. There are food vouchers out there. There are so many things in the community that the social worker can help you. Say, for instance, you also have issues with housing, transportation to dialysis. You cannot be able to transport yourself to dialysis, and you need help. That's the person you talk to, and they'll help you connect with the transportation services. Also, in other countries, social workers plays a major role, and these are the people who are well trained to help you, especially when you're dealing with those emotional ups and downs. They are the people who help you understand and feel, yes, you can do it in dialysis. You can still have a thriving life. Let's look at the other person. The other person that I do love, and I love every part of the team. But we also have a dietitian. Dietitians, they are the people that will help you. And you have to talk to them and talk to them about your meal. Because we know when you're in dialysis, you have to watch. And you can refer back to another video that I posted about food choices when you're in dialysis. That's the person who will be able to do a meal plan for you that will meet your budget. At the same time, this meal will be healthy. There are people who might be able to afford organic food, but not everybody can afford organic food. So just because it's not organic does not mean that food you'll not be able to meet healthy food plan or meal plan that meets your budget. You do not have to break the bank to be able to eat healthy. And that's why the dietitian come in. They also help you with some medications that you need to take while you're in dialysis. They'll talk to you. How do you need to take these medications? Especially those, the phosphorus binders. They are very, very helpful. They're the people who you should be talking to, telling them, hey, I've been eating, including the nurses and including your nephrologist or your nurse practitioner or your PA. You still need to talk to them about the medication that you're taking as far as phosphorus. But the dietitian will be the person be able to help you and say, hey, let's look at this other medication. Let's look at this other different thing. And then she'll talk to the nephrologist or the doctor or the kidney doctors. Nephrologists, kidney doctors, they are the same. So let's also look at if you choose, and those people that I have talked to about the dialysis nurse, the nephrologist, social worker, dietitian, those people will be there for you, whether you choose home therapy, whether you choose in-center, any modality you choose, those people will be there for you. But let's talk about this other group that is so helpful when you decide to do dialysis at a clinic setting. That's where you go to an in-center. And these people are called patient care technicians. They are the most important people. They play such a big role because this is the person who will see you together with the nurse. They'll see you from the minute you walk in to the minute you walk out of the clinic. They'll be there every single minute with you. They are the people who help you set up the machine. They are people who initiate your treatment. They are people who will monitor you during treatment. And they'll discuss those changes. If they say something unusual, they'll go and discuss with the nurse, or sometimes they'll discuss with the doctor. They are those people who knows you best because you're so close to them. You see each other on a regular basis. You get to talk. They are your friend and you are their friends. So they play such an important role. I love patient care technicians. They are my eyes. They are the people that tell me the changes that happen. What do I need to do? Is there something as a nurse manager do I need to address that we can help you have a good dialysis, a good care? So let's look at this other person. This other person is, if you choose either modality, there is a nurse manager. And either you choose home modality, whether you choose in-center, there is always a nurse manager. And this person, most of the time, they are RN. And also we have some places, they have a facility administrator. And this person is the one who oversees the overall care that you receive at the clinic. They oversee the team at the clinic. They also oversee your care. This person should be your best friend also. You should get to know them. And every time you walk, if you're new to dialysis, or you have just moved to a new dialysis center, or if you have moved to another city, ask to know your dialysis manager. That person, you should never be afraid to call that person. And I do appreciate those patients who call me because I tell them, if you're not there and you don't tell me, I cannot make it better. I have to know those things. There are things like I can't see every single thing, but that's the person I do appreciate. Even when they challenge me, they criticize, they make me think outside the box. So I have never looked at a patient when they bring their concerns to me as a complaint. I feel they are challenging me to think outside the box. And that's overall for all the nurse managers out there. They feel we are here for you to make sure you get the care you need and the care you deserve, and quality care, because it's very, very important to have quality care. Because without quality care, then you're not getting good dialysis. Your life is in danger. That's why you have to make sure you're discussing, you're meeting with these people. This other person, and I'm sorry, I keep saying this other person, and this is the last person that you may meet in dialysis as the care team. And this person is called biomed. These are the people that make sure your equipment, the equipment that we are using, are safe. They are learning, they are checked, they are monitored for safety. If they have any problem, these are the people that fix those machines. These are the people who make sure that the clinic has all the supplies that we need so that we can provide the best care that you need. So we love our biomed. Also, make sure you ask them. Ask the clinic. Ask that place. Even when you're doing home therapy, that's the person that might be coming to your home if you have an issue with the machine, to come and check what's going on with your machine. That's the person that will fix your machine if there's a problem. So they play such an important role, because without them, we cannot be able to provide that treatment. You cannot be able to take care. You cannot be able to take care of yourself or your treatment if the machine is not working. All these things need the biomed. All the machines need the biomed. They are the people who make sure you have all the supply. The chairs that you sit on, if you're in that clinic or that hospital setting where they use chairs or they use beds, the biomeds are the people who make sure those beds are safe. Can they lock? Are they tidy? Are they functioning? Is that chair, when you sit on it, does it feel comfortable? That person plays such a role, important role, to make sure even your chair is comfortable, that chair is functioning the way it's supposed to. If you decide to recline it, can that chair recline? So that biomed make you comfortable with the whole team. So make sure, if you're new to dialysis, or if you have moved to a new center, or if you have moved to a new clinic or a new country, make sure that you check and get to meet your team. Get to know who are the team. Who are those people taking care of me? Because these people and you together make the best plan. Make sure your treatment plan meets your needs and meets you specifically, because it's all designated for you specifically. Thanks again for joining me today to know our team, our dialysis nurse, our nephrologist, our social worker, our dietitian, our biomed, and our nurse manager, and at last, our biomed. Remember to subscribe, and make sure when you watch this channel, you are telling at least one person about kidney disease, because 1 out of 3 adults are at risk for kidney disease. And it's when we talk about it that we can prevent kidney disease, that we can prevent people getting into dialysis. Also, talk to people about the team you have just learned about. Ask your loved one, do they know the names of the team that are taking care of them or taking care of him or her? Also, as a family member, as a loved one, make sure you're meeting this care team. Call them. Say, let's know that care team that you can call and ask about your loved one. And I appreciate those family members who always call me, that are involved with the care, because as far as we know this team, the professionals, for those people who have who do dialysis at home, they have their loved one who help them. Those people also play such an important role. They know the machine, they know how to put the needles in, they know how to keep your house clean so that you can get a good dialysis, you can get a safe dialysis. So I appreciate those people and get to appreciate them because they are helping you live a thriving life. Thanks again. Remember to hit the subscribe button and that button, and please talk about it. Until next time, we'll be talking about dialysis medications and the labs that are so important while you are in dialysis, whether you're home dialysis, whether you are doing it in center, either whichever modality of dialysis you're doing, you have some medication that you'll be taking, and you have some labs that will be monitored on a monthly basis, on a weekly basis, and sometimes on a weekly basis and monthly basis. So we'll discuss that in our next channel. So I look forward to seeing you. Please don't forget to subscribe, and the reason why you're subscribing is to let us touch more people so that they can know, just because they have told they need dialysis or their kidneys have failed, they still can live a thriving life. Till next time, thank you. Let's love kidneys.